So I think without any further delay, we should just kick this off. Um, I'm Harry Hockheiser, the director of the Models of Infectious Disease Agent Study Coordination Center. And we are here today to learn about the CDC's Prevention Effectiveness Fellowship in the analytics and modeling track. And so to do this, I'm going to hand things off to Adam Skelton from the CDC. I will be here to monitor and keep track of things. But with that, I'll just hand it off to you, Adam. And we look forward to hearing what you have to tell us about the fellowship.
Fantastic. Thank you so much for having me. It is a pleasure to be speaking with you. I'm going to share some slides here. So everybody should be able to see them. I've got some colleagues joining me, or should be joining me. Doctors Carlo Davia-Payan, who's our subject matter expert within the fellowship, and two current fellows, first-year fellows, Casey Zipfel and Patrick Clay, who I think they both attended this webinar last year. And spoiler alert, I think we have 5 or 6 fellows in the first class that actually attended this Midas webinar. So that's pretty cool. So I'm glad we're getting a chance to get to you. If you have any questions about this fellowship, please email me at askelton@cdc.gov. So I just wanted to make sure you had that initially. I'm going to talk about this modeling track, and essentially our vision and mission boil down to we want to build modeling capacity at CDC. We want to engage modelers with a wide range of backgrounds, engineers, disease ecologists, mathematicians, operations researchers, and we want to get them excited about working at the CDC and at the federal government around modeling. When people talk about what do you do that's modeling related, I thought I'd just share some of the publications that have come out of CDC related to this modeling. And this is just a set of publications that were kind of opportunistic to me because some of the co-authors are on our current steering committee. Mike Johansson, Matthew Biggerstaff, Rachel Slayton, they all are part of our modeling fellowship steering committee. And so I had some of their publications handy and wanted to share them. This is the kind of stuff that we're doing. Certainly COVID has provided lots of opportunities to model, not only model the disease, but model interventions, mask policies, school closure policies, distancing, vaccines, that kind of thing. So I just wanted to share that. Our aim is to recruit and train fellows in modeling, provide opportunities for you to use the wealth of data at CDC. We've got a ton of data. We've got way more data than we have people to analyze it. We need interesting research questions asked. We need interesting modeling methodologies applied to the data. And we need people who are willing to participate in the federal sector. And, just another spoiler alert, the federal sector is kind of half bureaucracy and half academic. And so it creates this, creative tension, I think. And a lot of people love it. And hopefully, the modelers that we're engaging will love it. So what we want to do is engage quantitative scientists with the backgrounds that I had mentioned: mathematical modeling, statistics, disease ecology, operations research, and industrial engineering. Even big data analysis, biomedical and health informatics, all that. and we want to engage those folks within the 2-year fellowship. Obviously, if you're competitive in the fellowship, we expect that you do have this terminal degree in one of the fields, that you want to work in applied public health. It's not something that a lot of folks have thought about when they're in grad school, but it's an interesting field. We'd like folks to have a range of methodological backgrounds, certainly proficiency with standard software for analytics, experience writing, good communication skills and data visualization skills. This is what we call a tool set. And we like people to come in with a tool set, but we also like to have people come in and want to build their tool set. That's what the 2-year fellowship is. It's a 2-year commitment. It's immersed at CDC. We do have a competency-based curriculum that I'll talk about in a little bit. We do have performance requirements that I'll talk about. Each fellow has a supervisor and a separate mentor who's a modeler at CDC. So there's plenty of opportunities for guidance. It's a learning fellowship. So we expect people are going to apply experiments every day, not necessarily modeling experiments, but we understand this is people's first job. And we want you to make mistakes. We want you to try things. We want you to get involved in networks here at CDC and make mistakes. That's what this is for. And that's how true inquiry happens. So I mentioned performance requirements. We expect all the fellows, once they graduate from the fellowship after 2 years, to have 2 manuscripts suitable for publication. This is a minimum. Most fellows have this at the end of their first year. And in fact, one person who recently graduated from the fellowship had 8 publications by the end of his 2-year fellowship. So you can really accomplish some of your professional goals here during the fellowship. It's a very fertile environment for publishing. There are strategies, obviously, that we hope that people employ when they're here to publishing. We want people to develop and deliver 2 professional presentations. One should be at a peer-reviewed conference. We want people to develop and deliver 2 methods-based trainings. This is really easy at CDC. 1, because you certainly probably know lots of methods. And 2, we facilitate those trainings through seminar series. We'd like modelers to make substantial contributions to CDC models. And I know this sounds subjective, but we're kind of new to these performance requirements. This year is our first year doing this fellowship where we've got fellows involved. And we have a set of competencies. We certainly want for people to be, I've got public health science and practice listed twice there, I'm sorry. But we'd like people to learn about public health. It's kind of an immersion program. We'd like people to learn various aspects of modeling, learn communication skills around modeling, and become leaders, or become people who want to become leaders. That's what we'd also like. Certainly, we have a draft curriculum. We've engaged the folks at the DARTH Working Group to deliver our Introduction to Decision Modeling. This is the 3rd or 4th year we've had them come in and do this. We have an exceptional economist from University of California, Davis, Jeffrey Hotch, who does a course in concepts and cost effectiveness. And we've engaged John Drake and Pej Rahani to deliver a modified course that they've delivered on intermediate and advanced disease transmission modeling. And they're just down the road at the University of Georgia. And so there are opportunities to collaborate with them as well. We have various software trainings that people would like. The DARTH working group certainly focuses on R, but we've got other opportunities for software training as well. We've got seminars that we deliver on econometrics and modeling methods. And I mention econometrics because you'd be surprised at how much modeling economists do. And that's kind of in the past what the fellowship is focused on. And we'd certainly see and appreciate that. It reflects one of the things you can learn here. Certainly data visualization, and over the 2 years, we'd like people to become really, really good project managers of their own projects, and maybe even as teammates on other projects, and that kind of thing. It's an important skill to learn. I mentioned that you'd be immersed at CDC, and certainly that is in work with research teams. But it's also within your cohort of fellows that we have what's called action inquiry groups, where basically you take a challenge that you've seen at CDC and everybody talks about it. How would they resolve that challenge? Why is it a challenge? What are they trying to accomplish? That kind of thing. It really helps the adjustment to this complex environment, this complex research environment. We do have seminar series, again, mentioned those before. There are also other CDC lectures. And certainly there are professional conferences that you can attend. We engaged 21 new fellows in the public health analytics and modeling class of 2021. This is them. And you might see some names you recognize, but we're thrilled to have them on board. And when the next class joins, they'll be second-year fellows available to collaborate with as well. I'm going to turn the floor over to Patrick Clay, and he can introduce himself and spend a few minutes talking about why he was interested in the fellowship here, whether he was surprised at what he found after he joined CDC, what his current projects are, and he's got some of them listed there. But what are some surprises and challenges and good things even that he's experienced since he's been here? Patrick?
Hi, like I said, I'm Patrick, first year fellow. So I was in this session last year. My background is I have a PhD in ecology and evolutionary biology. My background is on modeling infectious diseases, more in natural wildlife populations. And specifically, my background is in modeling populations where you have multiple pathogens that are interacting with one another, and figuring out how do we model epidemics when you have multiple pathogens that are, traversing through a population at the same time and interacting with one another within hosts, that sort of thing. So that's my background. I was interested in this fellowship because I had been looking to get more into the applied side of things, specifically seeing if I could apply my work and my modeling skills to human health questions. And obviously the CDC seems to be the perfect opportunity for that. I have found that since joining the fellowship, one really good thing is that you are always in connection with experts in every aspect of human health and modeling. If I'm trying to put together a model, and I want to talk to like clinical people who actually have hands-on experience with the disease, or if I want to talk to, hey, you run a clinic, what are like the decisions that you're having to make on the ground on a day-to-day basis that you need help with? Those people are very much, on the teams that I am part of. They're very much in my division in the CDC. And so there's a lot of collaborative work that is really helps you make sure that your work is very impactful and well-informed when it comes to the decisions that, public health people have to make and people who run clinics have to make. So I joined the division of STD prevention. And that actually is a really good spot for my particular skill set, because if you think about STD transmission, we often have to think about multiple STDs at the same time that are interacting with one another. Either it can be individuals who have HIV are more susceptible to other pathogens, or it can be, if you're at risk for one STI, you're probably at risk for others. So how do the sort of behavioral interactions between pathogens, go into a model? The projects I've been working on so far, the big one that I'm pretty much finished with now, I spent the first couple months on, was just trying to improve our methods for estimating how many people get chlamydia each year in the US. And that's really important because if we're saying, all right, we just implemented this new, chlamydia response, was it effective? We need to have a good way to measure changes in chlamydia incidence over time to sort of test whether the things we're doing are working or not. And in the next couple months, I'm going to be tackling other projects that work on, what are the best testing strategies to overall deal with the STI burden in the country. So you could say, all right, we want a testing strategy that really focuses on people that we think are, most at risk to become infected. So people who have become infected in the past, we're going to test them more. Alternatively, you could have a strategy that's like, all right, we're going to try to test everyone, and that way we can maybe identify more people who need to be on PrEP, who need to be on medications that will prevent for future infections. So those decisions are what my future work is going to be dealing with. I think that's one aspect of being at the CDC that is really nice, is there's a big focus on what are the actual decisions that people need to be making, and how can your modeling tell people what decisions they need to be making. I think my background is more conceptual, but it's been really nice to say, no, this modeling is going to lead to a concrete decision that someone has to make. And that's it's been great so far. I feel really good with how my work is being applied. Happy to take any further questions at any points. Feel free to get in contact with me. But yeah, that's sort of my spiel.
Awesome. Thank you so much. And Patrick, that picture looks like you're taming a lion or something.
I am giving a seminar, but I'm very handsy when I talk. So.
There's not too much lion taming involved. But thank you very much. And we'll have plenty of time for questions afterwards. So let me go to our next. There we go. Casey, I'd like to turn the floor over to you. You can do the same.
Sure. Hi, everyone. It's great to see so many names joining and interested in the fellowship. My name is Casey Zipfel. I have my PhD in biology from Georgetown University, where my work looked at how human social behavior related to respiratory infectious disease transmission for flu, childhood vaccine preventable diseases like measles and pertussis, and then COVID. So sort of seeing how changes in that social behavior throughout an epidemic would alter patterns of infectious disease transmission. At CDC, I am in the Division of Healthcare Quality Promotion. So we study a wide range of issues, but a lot focused on MDROs, antibiotic-resistant organisms, COVID transmission in nursing homes and other facilities like long-term care facilities. And I'm on the modeling team in that group. And some of the projects that I've been working on, one sort of big project is developing models that are flexible so they can be applied to different organisms or bugs that are our questions, like C. auris or MRSA, integrating additional heterogeneity and detail into previous models that have been developed. So this sort of breaks down into some smaller projects, some focused on looking at finer spatial scales and sort of what is the spatial distribution of nursing homes and how does that impact our understanding of the data, looking at social vulnerability and how that might impact access to nursing homes and differences in healthcare utilization in different areas and how that might relate to transmission of our bugs of interest. And then also integrating things like background community characteristics, like non-communicable disease levels and what that might relate to integrating into our disease models. Another project I'm also working on is looking at patient transfer networks, networks of how patients move between different long-term care facilities or nursing homes, and how that might have changed throughout the pandemic and what the downstream effects might be on transmission of our bugs of interest and COVID as well. I've also been recently sort of deployed to the COVID response, where I'm looking at how we need to update our models of nursing home COVID transmission for the Omicron variant, adjusting our disease parameters, and sort of seeing what might need to be done differently in this new sort of scenario that we're looking at. I guess some sort of surprises or challenges about the fellowship. I was sort of a positive change was that I like echoing what Patrick said about really like working on an interdisciplinary team. That was something that was totally new to me and has been really positive. That previously, I would say, for example, I would be working with medical claims data, and if we didn't really understand how a code would be billed, we would kind of, we could reach out to someone, but we didn't have someone like there that actually has had experience with those billing codes. But then now when we have those issues, we have people on our team that have experience with that and can really directly inform that. And there's really sort of a team we're all sort of working towards the same goal. And I feel like that is a really positive thing that I didn't really anticipate as much coming into the fellowship. I also think there's been more opportunities and a wider variety of questions to look at than I had maybe anticipated. Like when I looked at the fellowship descriptions and different teams, there were a handful of projects, but my team has been really open to ideas that I have. And we've gotten a bunch of different sort of incoming questions from different areas that I've gotten to work on. So it's been like really a wide variety of experience of different projects and topics to work on. So that has been really awesome. I really like working on like a breadth of topics. So that's been a good experience to me. I guess something that maybe was a bit of like a challenge or something that I didn't expect as much was that data access across everything is maybe not as immediate or fluid as I might have thought. I thought everyone in the federal government had wealths of data and just were not putting it out into the public, but there's different issues with data access, of course. And I think that was just maybe more of a challenging surprise to me that I didn't quite anticipate. I guess that's sort of my thoughts so far on the fellowship, and I'm happy to answer any questions.
Fantastic, thank you. And yes, keep any questions for Casey on the tip of your tongue, and we'll have some time for that later. I think from listening to Casey and Patrick, one of the things that I wanted to mention to everybody is that it's really crucial for people when they join the CDC to be flexible and to understand that you're doing something this week and you might be doing something a little bit different next week based on some priorities, because the priorities are always related to the mission of CDC and the mission of the programs. Casey was talking about being pulled into this COVID-19 response. They're always looking for really smart people to do this, but we couldn't have predicted that 2 years ago that we had COVID. We couldn't have predicted, well, we did. We could have predicted the Omicron variant as all these other variants. But it's a great opportunity, but it's a real challenge to kind of drop what you're working on and work on something else for a second. It involves compartmentalizing in your mind some of these things, and it can either be really fun or really annoying. And we're hoping that it's fun, but that people get back to their other projects or able to do things in parallel to some extent and that kind of thing, because there's a lot to do.
Adam, there's a question on the chat.
Okay.
It says, thank you for the thorough presentation. I am
Oh yeah,
applying.
we're getting to that.
Mhm.
We're getting to that in the next couple of slides. So right now, the application is currently open, and you can apply at cdc.gov/PEF, and that will let you kind of into the application website. We intend to, that application is open until January 15th. At that point, we'll review applications and we'll have an understanding of the number of host sites we'll have, and we'll set up we'll give all the competitive applications to the host sites, and they'll determine who they want to interview, and then we'll set up interviews in February, and then we'll notify people of the match. And basically, the match involves this process. The folks who are interviewing fellows, the programs that are interviewing fellows might interview 5 or 6 or 7 people. They'll rank those people from 1 to 7 or 6 or how many of the folks they want to rank. Now, you as people who are having interviews might interview with 3 or 4 programs, and you'll rank those programs 1 to 3 or 4. And we've got an algorithm, match 1-to-1s, and those match. And then we match 2-to-1s and 1-to-2s and 2-to-2s. And I think out of the incoming group of fellows, there weren't any lower matches than 2-to-2s or 2-to-3s. So that's a good thing. It's like the interview process really gets people to understand who's interested in what programs and which programs are interested in what types of fellows. And then we start an onboarding process, and then it starts in August. Just to give you some understanding of the job cycle. Sorry, I'm trying to advance. There we go. So one of the things we're really interested in, and I wanted to touch on in this presentation, we're really excited about the CDC planning to build the Center for Forecasting and Outbreak Analytics, and this is an actual national center at the CDC, which would be under the Deputy Director for Infectious Diseases, and we've have a couple of folks who are spearheading a team to stand up that center. One of them is a fellow named Mark Lipstitch, and another is a person named Dylan George. You might be familiar with some of those names, and they're leading the development of this center. It's essentially focusing on creating an interdisciplinary scientific and policy and programmatic team to do modeling and leveraging lots of different modeling methods and data within the key areas that we tend to be doing modeling around. And recently it had been focusing on COVID. Prior to that, Ebola. Prior to that, Zika. Prior to that, pan flu. But then there are also engaging with modelers throughout CDC in the current programs that the CDC has. Things like opioid overdose, things like tuberculosis, HIV, you name it. And so the center will be kind of this kind of organizing group as well. And we're really excited about that. And I think they're going to host 3 or 4 fellows in this upcoming cycle. And certainly, we've tried to fly under the radar over the past couple of years, but just in case, to make you aware that the CDC modelers have been kind of near the front of all this in terms of modeling, cases and hospitalizations and deaths around COVID, focusing on epidemic prediction, you name it, engaging with other NIH-funded groups, other academic groups, and certainly building lots of models and forecasts. Most of them, obviously, are for kind of internal use and internal policy. And it's great to be able to engage folks like you around this work. And certainly focusing on developing these core capabilities with professional folks like yourselves, aligning all those to strategies to support the primary mission of protecting America's safety, health, and security. And certainly the long term would be to build the capacity within not only CDC programs, but within this National Forecasting Center. I'll leave that up so everybody can read it. And here's another one, predict, inform, innovate. So I'd like to open everything up for questions. Harry and Stephanie, I don't know how you had planned on doing it. Just go through the chat or Q&A or allow people to undo their microphones. I don't have any preference.
Why don't we start with what's in the chat and the Q&A, and then we can invite people to speak up if they want to.
Perfect. I've gotten a question from Catherine. Yes, we're planning on making all sorts of changes as we learn more about modeling needs at CDC and trainings that people will appreciate, and the capabilities that they have coming in, as well as how to best match fellows with opportunities here at CDC. That's an important thing as well. We do not know yet how many fellows are planned. My guess is 10 to 15. And again, I think we can assume 10 to 15 different organizational units at CDC will be hosting fellows, one fellow per, the only deviation from this is that actually Patrick is in a program that's hosting 2 fellows. So his colleague, partner in crime, is Emily Pollock, and they're both in the STD division because there's lots to do. So very few programs will actually have 2 fellows, but I'm not ruling that out. We haven't gotten much feedback yet because it's only in the 3rd month of the fellowship. Fellows started in August, but we do intend to get lots of feedback and to learn a lot about this. But again, there's lots of uncertainties. And so to some extent, we kind of have to continually improvise. And the 5th question is, there have been talks about return to work at CDC. There have been seminars and there have been directives from HHS and things like that. I'm aware that they're currently still working on proposals and I don't want to say policies because it probably won't be policies. It'll be practices and preferences around working remotely, around telework. I do expect that's going to be a big part of the job moving forward. And so it will require us to focus more on remote engagement. And that's a particular set of skills that you have to cultivate to feel like you're part of an organization and part of the importance of what your team is doing while not being able to be there physically. We expect that it'll be gradual, meaning very likely we'll go to kind of important meetings only on site. Then we'll go to a few days on site. And certainly, there is a vaccine mandate with the federal government. There will likely be mask mandates, and there are being certainly changes in CDC buildings having to do with sanitation and hygiene and airflow and things like that. So people are working on this full time. This year, we actually have fellows located in Washington, D.C. We have fellows located in San Juan, Puerto Rico, because that's where the dengue branch is. So we'll know where the fellows will be located once we get assignment proposals. I hope to get one from the vector-borne illness branch, which is in Colorado Springs. I'd love to send a fellow to Colorado Springs. And they need a fellow. Oh, there you go. You mentioned Fort Collins. So yes, I'd love to send a fellow out to Colorado. And so we're working actively to try to find programs that want to host fellows. We're also working on our budgets, so we're trying to figure out how many fellows that we have money for as well. That is our program, because our fellowship basically requires the hosting program to fund the fellows. And so a lot of the time we'll get applications from programs that have money, but then we're going to have some money and we'll be able to assign fellows to places. And that'll allow us more flexibility to look at underserved programs, to look at interesting programs. It would be neat to have some of these modeling questions answered. So, other questions? Let me go into the Q&A here. Matching of the fellows. I think I kind of hit on the matching. It's kind of like a residency.
At the sites.
A lot of the time, the key element of matching is fit. And what I say there is they're looking for people who are not necessarily rigid in their scientific thinking yet. Just because we don't know what's around the next corner here at CDC. We need people who are flexible and have a set of skills and are willing to build those set of skills to meet the needs of CDC. Not necessarily people that are fully baked in their skill set and know what they want to do and are really rigid about wanting to do that. Because it's very likely that you won't. One of the things that I tell the fellows here at CDC when they start is don't get too emotionally attached to this stuff, because something may happen tomorrow and you might get pulled onto a different project and have to work on that. And so we really try to get people to be flexible, and in the interview process, express that flexibility to the interviewers. Another question is, what possible host sites are there? I think I hit on that we don't necessarily know yet. And if you're interested in looking at vector-borne diseases, certainly there are all sorts of other host sites that are hosting fellows that aren't necessarily a vector-borne organization. For example, the malaria branch is looking to host a fellow. They're not in the same branch as the Fort Collins branch. So across CDC, you have some overlap, and hopefully, you can go to the CDC website and learn a lot about the CDC and learn where the different organizations and areas at CDC are in prep for any understanding about who's going to host fellows. Because at this point, assignment proposals have to be in by January 15th. And so we don't know necessarily who's going to host fellows. Yeah, in your application, I would emphasize how that you have a wider breadth of interests, that you can apply your tools to a wide range of diseases, to a wide range of modeling scenarios. And the next question is for Patrick and Casey, and I'll let them answer if they'd like. And that has to do with building connections and mentorship while working remotely. So I'll turn that over to Patrick or Casey.
So there is some difficulty in not having a lot of, you're not in person in meetings with people. However, everyone is assigned both a supervisor and a mentor, and you are part of it. So my team that I'm on is about 6 people, and I get a lot of FaceTime with those individuals. And my mentor is really good at introducing me to people and telling me who I should be working with. We're on this chlamydia project I'm working on. He's very good to say, like, oh, hey, I'm going to I'm going to, set up a meeting between you and like the clinical team so you can show them their work and like they can tell you if your modeling assumptions make sense. Or, hey, like this project could have a cool economics component. Like there's a really good like economist in the team or like on the neighboring team. So I'm going to set you up a meeting with him. So because you have that mentor, you and a supervisor and other people on your team, they are good at setting up a network and giving you opportunities to meet people who can sort of help you on your journey. So.
Yeah, just bounce off of that and say also like a strategy that I've been trying to employ and that I've had people recommend to me is just like over communication, especially when you're new, there's so many like little things that you might not quite understand or know where to go for it. And just being overly communicative and having lots of meetings that help you build those connections and build that feeling of mentorship and access to other people. I also think we've started to build sort of a network within the fellows themselves that we have sort of our seminars and our courses that we're getting. I mean, it's not quite the same as not being in person, but at least you're seeing the same set of names and interacting with the same people, once, twice a week at this point. So I think that sort of starts to build that network as well. And then you have people that are going through similar experiences that you can bounce off of, or opportunities for collaboration, or just to sort of discuss what's going on. So that's been a nice network too.
Yeah, and fellows participate in trainings, so they all kind of get together in their work groups and in the trainings as well. And so hopefully they're building connections there among each other. We of course recommend lots of check-ins on projects with project teams. We recommend status reports, and we certainly recommend weekly meetings with supervisors and mentors, so you can check in that way. Yeah, those are good points, Patrick and Casey. Is there a preference for applicants who have just graduated and not had a postdoc position before? This is a postdoc, so you don't have to have had a postdoc before. And we fully expect that this is your first postdoc. I think there are a few folks who come here from postdocs, and that's well and good. But we expect that people are going to come straight from graduate school and to here. And that's hopefully a good thing.
To jump in there, I had a postdoc before I started the fellowship, and there seems to be no issue with that.
And I didn't, so you can have both.
Yeah, and so the next question is kind of the same. No, this is for folks. We do want you to have completed all of your requirements for the PhD by mid-July so that you can join in August. It's one of the HR rules. They want to make sure that and by completed the requirements for the PhD, we mean that you've taken and passed your comps primarily. And you can get a letter from your director of your program that says this person has completed all the requirements for the PhD, because we know that some of that isn't going to come until graduation. There are different graduation schedules and registrar rules for hosting, that kind of thing. We're trying to be as flexible as we can about that. This is for folks who come right out of school in most part. The last question that I have here is, thank you so much for the detailed presentation. Is the fluency in programming language a required skill for the application? No. And again, that's because you can learn that here. We have, trainings. We have all sorts of resources that if you wanted a particular skill, we've even sent people to courses on, for example, big data analytics. In fact, I think we sent one up to UW a couple of years ago, last year, to take a course in that. There are all sorts of learning opportunities here at CDC. There's this thing called the CDC University, and they have courses. There's HHS Learning Portal. They have courses there. And then there are specific courses that we can put together for fellows if we find that there's a big enough need for that. We had a Python course last year that we might rerun this year if there's enough interest. Any other questions? I think there's another one. Okay. Are there additional application considerations related to administrative timeline and assignments for non-citizens? Thank you for the question. Over the last 10 years of the fellowship, 40% of fellows, well, closer to 50% of the fellows have been non-citizens. And the non-citizens would certainly go through the same application process as everybody else. And then if you match with a program for the fellowship, you immediately have a conversation with the immigration office at CDC, and they will determine through a flow chart that they have what the most appropriate visa would be and the visa pathway for covering your entire 2 years here at the fellowship. And so I can't give out immigration advice, but we do have an immigration office, and they work with incoming fellows on those kind of things. And certainly there are different timelines because of things like prevailing wage determination and the whole H-1B process and any J visa renewals that need to happen, or OPT STEM extensions that need to happen, or even a TN visa has a specific process for Canadian and citizens of Mexico. Let's see. Oh, the percent of PE fellows in recent years who have stayed with CDC, over the years, there have been around 200 graduates of the PE fellowship. This is over the 25 years of the fellowship. We currently hire 77 current graduates of the PE fellowship. So a fair number have stayed with the fellowship. This includes a bunch who have retired since they started in the early years of the fellowship, that kind of thing. So there are lots of opportunities for staying on at the CDC. Fellows that join the fellowship occupy an FTE, and so their time during the fellowship counts as government service, right? So once you are in the fellowship and you're at a GS-12, then you're able to apply for a position at the CDC after the fellowship at the GS-13 level because you have 2 years at a 12. And so the U.S. citizens would apply for Title V positions, and non-citizens would apply for Title 42 positions. And very often there are openings, and we expect that with the emergence of this new national center that there will be openings. In terms of percentage of folks who move into universities, industry, or NGOs, that's probably every year is probably 30%, 30 to 40%. There's basically 3 breakdowns. First is people who extend the fellowship for another year, and this is basically an HR tool that allows us to extend a fellow if they haven't found a job at CDC and their program would like to keep them on board. Okay. Second would be people who have actually applied for a job at CDC, a full-time job, and have gotten that after the fellowship. And third is people who leave the fellowship and go to academia. In the last year, I think we had 3 people leave. One is at Emory, one is at the University of Chicago, and one, I can't remember. There's a third that's out there someplace. I can't remember where she is. But usually the fellowship gives you good opportunities outside the fellowship. And they're, what I like to say is that if you can work at CDC, you can work anywhere. So let's see. I don't have any other questions. Does anybody else have any questions? I prefer questions for Patrick and Casey.
There's another question in the chat from Catherine.
Is there? I didn't see. Oh, what would you say the biggest challenges the models have faced? Well, I'll open that up to Patrick and Casey. What are your challenges?
I think one of the biggest challenges that I've faced so far is balancing all of the different projects and everything that I've been involved in. So balancing the PE fellowship courses and the work for those, as well as working on the response, as well as all the work that I'm keeping going in my own division itself. So sort of there's several different hats to wear and lots of different projects, which is exciting. And I really enjoy being able to get a really broad experience and work on different things, but it's also can be challenging to sort of make all that fit in your 40 hours a week. I think that's sort of my biggest challenge so far.
And I'd say I think my biggest challenge, so prior to the CDC, I did a little bit of COVID modeling with part of One Response, but outside of that, this is my first time working with sort of human health stuff. And so there's a little bit of, when you move into a new field, there's going to be some reference. Before, when I was in my postdoc and at the end of my PhD, I was like, I got this. Like, I can write this paper myself. Like, you check it at the end, but like, I feel like I'm fully an expert. Now there's a little bit more of like, oh, I need to check in with people. Like, what do clinicians expect to read in the papers? Like, what is the best way to talk about human health and sort of socioeconomic drivers of that? Like, what is the language for that? So there's a steeper learning curve than I would have had if I had stuck with sort of my bread and butter work that I was doing before I got to the CDC. But along with that, I feel like I am learning new things at a much faster rate than I did when I was a postdoc. There's a lot of new things and there's a lot of new growth that is happening because of that.
Mm-hmm. My biggest challenge has been this whole working remotely thing. This is the second class in a row that we've had to onboard remotely and haven't necessarily been in the office. And I think it's such an opportunity to get to know folks and to have lunches out at restaurants, local restaurants, and we normally have our orientation in person, and we get there early and we talk, and it gives me a chance to meet folks and to socialize and things like that. And we haven't gotten to do that over the last 2 years, and I think that's a real challenge. Some folks have put together virtual coffee hours and things like that, but I think we have to get back to meeting together. Get a table full of people at one of the cafeterias on the campus, on one of the campuses. There are a couple of three different campuses here, and so getting people together and talking, and sometimes that is talking about work, and sometimes it's not. And I think that that's an important part of the job and a challenge now. Let's see. There's another one. To Casey and Patrick, do you have any tips, suggestions in what to highlight in your application, how to best identify fit while in the remote interview process?
So in feedback I got from my team when they were talking about why they decided to sort of rank me high and eventually take me on, is they liked that I said, I have all these different modeling skills, I can adapt them to whatever question you need, but also I am very willing to take on new modeling skills. I'm not going to walk in and say, all right, this is how I model things, take or leave it. Rather reading their papers and saying like, okay, I don't know this skill, but I've learned 5 different ways to model things. I can learn a 7th and 8th, and I can adapt to your team and how you do things. And I have sort of the conceptual basic modeling skills to be able to grow in those new ways. So I think showing that you do have the base skills, but also are willing and able to grow to meet the needs of the team you join. I think that's what they told me that I was able to show that they really liked.
Yeah, I agree with Patrick that highlighting like an interest in learning. Especially if I feel like there's a big shifting coming from an academic background and learning about how the role that the work you do might play in policy or applied public health. That's something that I really emphasize, that was something I really wanted to get experience with. And I think like perhaps that might have made me a good applicant maybe. Also just I mean, this is probably obvious, but something that helped me match with my group is like highlighting what I had experience with and having a good match with that sort of method and applying it to new questions, very similar to what Patrick said. Like, for example, I talked about my experience with network modeling, and that was totally in one context, but my team really, I think they saw network modeling and they were really interested because they had this question that they wanted to get addressed with someone who had experience with networks. And that was also a good way for me to feel like, okay, I'm not going to be totally out of my depth. I'm going to be able to take some of these things that I've learned and that I have experience with and apply it to new questions. So I feel like that was a good two-way street, but is probably more common sense.
And I would say as well, in your background research into CDC, or that you then might express in interviews or your application, would be to express your understanding or appreciation of the epidemiology culture of CDC, because all of the models that you're going to be developing here have a foundation in epi data. And to understand the basics of that, and understanding that a lot of you haven't taken a course in basic epi, but to understand that that's going to be your first thing you'll probably learn is rates, ratios, that kind of thing, standardization. You're going to try to understand that epi data that makes the foundation of that. Then to apply the other data within the modeling formats is important. But understand that you can't swing a dead cat around here without hitting an epidemiologist, and that's the people that are going to be the consumers of your models and sometimes the collaborators around them. That's a Kansas term, by the way. There aren't many dead cats around here, but that would be some advice from me. I know we're coming up on the time, but please reach out to us well, let me see, there's one in the chat. Oh yeah, there's Harry. Please reach out if you have any other questions, either through the PE website or to me, askelton@cdc.gov. Please let us know what, yes, taking an EPI course would benefit the application. Yes. So that's what we've got. Thank you so much for this opportunity. It's great to be able to speak with you and bring a couple of folks who were here last time to do this. Thank you, Patrick and Casey. And thanks, Harry and Stephanie, for giving us the opportunity to do this.
Great. Thank you so much, Adam. Thanks, everybody, for attending. And this will, I think, soon be posted on the Midas website, so you better watch it there as well afterwards. And Adam, I'll get you that link. Thank you all.
Thanks. Take care.
Take care.